Have you been told by your OB or your primary care doc that you can't have menopause hormone therapy because you do not have hot flashes, therefore you do not qualify and you cannot be helped by hormones? That is not true, and you need to see a menopause specialist. Let's talk through why your doctor might have said this. So when we look at the huge trials that were used to approve menopause hormone therapy for treatment of vasomotor symptoms, they solely were primarily looking at hot flashes. So that some of them recorded them objectively through a skin sensor, some were recording them subjectively by having patients report their hot flashes. But when someone was organizing the trial, they thought, what is the cardinal symptom of menopause and what is something we can really measure objectively? And they landed on hot flashes as the marker of menopausal symptoms in those studies. That does not mean that those women were not having other symptoms and that those other symptoms were not improved with menopause hormone therapy. While we don't have as big of a body of evidence showing that menopause hormone therapy improves these other symptoms, we do have a lot of evidence showing that it improves depression, musculoskeletal pain, libido, sleep. There is bone health, genitourinary syndrome of menopause. There's a lot of data showing that menopause hormone therapy, estrogen and progesterone, and testosterone for hypoactive sexual desire disorder can help with the symptoms of menopause, perimenopause specifically. So I tell my patients, broadly, simply, there are two reasons you might want to consider menopause hormone therapy. One for the symptoms of perimenopause, two for the disease prevention of postmenopause. Now, do we have enough data that the Menopause Society has said bluntly that those same things I just said? No. The Menopause Society will only come on board and support the use of menopause hormone therapy for the treatment of vast perimenopause symptoms when we have the data to support that claim in a huge way. In a $1 billion study, randomized control study that looks at mood lability, libido, those things are really hard to measure. It's not something a pharmaceutical company necessarily wants to set out after trying to measure mood lability and perimenopause. But we have so much data that menopause hormone therapy can improve those things. And so until we have all that data, the Menopause Society is not going to come on board and make those blanket statements. But luckily, the Menopause Society, if you read their clinical guidebook or you read their position statements, they do say there is some data to support this. There is some data to support this. So they leave it more of a gray area, which is where your menopause specialist physician should come in and talk to you about risks and benefits on all sides. What data do we have to support using menopause hormone therapy in perimenopause? I use menopause hormone therapy all the time in my perimenopausal symptoms to treat an array of symptoms outside of hot flashes. Hot flashes are not some gate-like ticketed item. You can't have hormone therapy in my office until you have hot flashes, because some women will pass through perimenopause very symptomatic, but without hot flashes or night sweats or feeling hot all the time. And that's okay. They still deserve treatment for their perimenopausal symptoms and support after with disease prevention. So please don't let someone gaslight your other perimenopause symptoms. Please don't be discouraged if you see someone who's not well-versed in menopause and they say, no, you don't really qualify because you don't have hot flashes. Their understanding has not caught up with what we have in the research, and I would say you need to see a menopause specialist. I'm Dr. Malia Swanson. I see patients in Colorado, but you can go on menopause.org and find a menopause specialist that sees patients in your state, and you deserve that.